Thank you. And it's a real privilege to be joining all of you today from unceded Algonquin territory, where Spirit Bear and I spend a lot of time. I want to talk about colonialism today, but not colonialism in its past sense, but how it actually is shaping our lived reality today. And what equity looks like when you're searching for it within nations within nations. Canada has a rather good reputation for a high standard of living writ large. But when you take a deeper dive and you look at what's happening in First Nations communities, what becomes unveiled is truly an apartheid system. So I want to begin by just looking at colonialism. There's lots of definitions for it, but the one I particularly like is by Eduardo Galeano, who's a Uruguayan journalist and writer. And he writes that blatant colonialism mutilates you without pretense. It forbids you to talk. It forbids you to act. It forbids you to exist. Invisible colonialism, however, convinces you that serfdom is your destiny and impotence is your nature. It convinces you that it is not possible to speak, not possible to act, and not possible to exist. Colonialism isn't just marked by what you see. In fact, as Galeano really points us to, it's often what we don't see, what becomes normalized within the fabric of a society. And even in our own patterns, we become programmed into relationships for First Nations in government that often actually perpetuate the colonial relationship versus disrupt it. So I'm just going to give you a couple of examples of things that we don't see, just building off of some contemporary issues. Many of you have seen with the COVID spread in the United States that the Navajo Nation have had rampant COVID rates. In fact, it was at the top of COVID infections in the United States for many weeks. And reporters are rightly quoting the fact that there are only 1 in 3 households on the Navajo reservation have water. But what they didn't really get down to is the inequitable federal spending on healthcare. The federal government of the United States provides funding for 3 groups of people for healthcare. One is persons in the armed forces. Second is federally incarcerated prisoners. And the third group are Native Americans. And what you can see just with 2 contrasts here is that federally incarcerated prisoners receive $6,973 per capita, whereas Native Americans, like those persons on the Navajo reservation, receive $1,297 per capita in healthcare. So what COVID was doing is really nesting itself within the existing inequalities that exist there. And I'm not arguing in this slide that federal incarcerated prisoners don't deserve a $6,973. What I am arguing here is that there is no rationale for Native Americans to receive $1,297. Here's another thing on the Black Lives Matter movement in the United States. This is data from the Center of Disease Control. And what we can see here is that Native Americans actually per capita are more likely than any other racial group to be killed by law enforcement in the United States. Now, this is not to take away from the good work and the legitimate crisis facing Black Americans, but it does call us into question of why aren't the deaths amongst Native American persons part of that conversation. And indeed, that's part of what needs to also be spoken about here in Canada, and that First Nations and Inuit per capita are amongst the most likely to die in fatal police shootings. And here's another piece, is that Canada is doing poorly for children, just all children, and particularly for First Nations children. Since Confederation, the federal government has provided services on reserve, public services, things you already need, water, sanitation services, education, etc., and has done so to a lesser level than all other Canadians. It is the archetype of really a apartheid policy, and it's governed by the Indian Act, a piece of legislation that allows the government to make determinations about who is and who is not a status First Nations person. When we talk about systemic discrimination in Canada, too often we skip over these pieces that have really affected a lot of folks. But what we know, for example, in COVID, is that only 35% of First Nations have broadband access. You are listening to me because you have broadband access and you have a computer. Imagine if you're in First Nations community where you're more likely to be vulnerable to COVID in the first instance and then not even have access to the internet to get health information, to connect with people when you're socially isolating, or in the case of First Nations students, to even learn. And we can't lose touch of the fact that First Nations children, for some of them, their dream in life is to get a clean glass of water. Now, some people always say to me, well, these things are to do with remoteness. But the International Space Station, population 6, not only has clean drinking water, it also has excellent broadband access. So it has nothing to do with technical capability. The ability is there. The political will is not. On the child welfare side, we talk about overrepresentation of First Nations children in care. I don't like the word overrepresentation because it's too easy to say. And I think it stops us from thinking about it the way kids think about it. So this data is actually on reserve only, and it's a number of sleeps that First Nations children spend away from their families between 1981 and 2017. And that comes to 78 million nights. That's over 160,000 years of childhood. That's what the inequalities in child welfare, but also among those factors that drive the overrepresentation, namely the poverty, the multi-generational trauma that leads to addictions, and the poor housing. Those are the drivers. Without dealing with that, then the burden of it is experienced by these children. In 2000, we actually worked with the government to produce a report documenting the inequalities in First Nations child welfare and recommending solutions. The government welcomed the report and did nothing about it. And that is a consistent pattern in government. Government often says when it comes to First Nations peoples that, oh, it's too complex, leading the general public to believe that the reason that things are not getting better is because the government doesn't know better. But that's far from true. And inequality is a huge driver of colonialism. In many ways, I would argue it's the contemporary driver of colonialism. By creating unequal levels of services on reserve, and by fixing the boundaries of reserves. And what I mean by that is if we took a municipality like Toronto and we looked at what the city boundaries would have been in 1867, those boundaries would have been a postage stamp on what we now know to be the GTA, the Greater Toronto Authority. But for First Nations, those postage stamp pieces of land never expanded with population. So we've got the same fixed boundaries and we've got dramatic inequality, and then we layer on multi-generational trauma. And so this inequality drives people off reserve. It drives people away from their culture and language. It has a very assimilation type effect. And so we worked with others around the Americas, and Sir Michael Marmot, who's a worldwide expert on health equity. And we came up with this report called Just Societies, Health Equity and Dignified Lives. It really looks at the holistic understanding of health within the Americas, how to focus on persons of Afro descent and Indigenous persons. And you'll see here, it takes the Euro-Western determinants of health, but it frames them differently. It recognizes the land as a determinant of health, not just climate change, because that's kind of a Western concept as I see it. Climate change is when the environment is a threat to you, i.e. the ravaging wildfires that are happening on the West Coast, or the frequent hurricanes coming out of the Atlantic. Land is different for Indigenous people. We are of it. It is not separate from us. And our whole, as part of the land, It creates a different embeddedness of your identity, of your memory, of your legacy, and of your ability to sustain yourself. The other thing that's here is that colonialism is not post-colonial. So when we talk about post-colonial theories, I think, well, who is actually in that place? Because I don't know a First Nations who would say that they're in a post-colonial relationship. Well, the Indian Act and these ongoing inequalities and Canada's lack of the implementation of UNDRIP are among us. So let's get back to the barriers. Why is it that government doesn't do better when we know better? And I actually think academia has been a big problem in this. In that academia is based in Western neuroscience, and it has a very bad memory. It likes to think that the reason that problems are unsolved is because it hasn't solved the problem. And when we looked at the inequities for First Nations children, we can go back indeed to 1895 and find evidence of these inequalities and recommendations about how to address the inequalities and how to make it better for First Nations families. And really what changed over the decades was just the wording we would use to express that. But the solutions were consistently on the books. And what happens is government uses research or inquiries or projects like that to look like they're doing something without actually resolving the problem. So I was interested in kind of how that mapped out against genocide, especially after the Murdered Missing Indigenous Women report said that really Canada's conduct, as well as those of provinces and territories, was genocide. And many of you saw the big uproar in Canadian society about, wow, we don't do genocide here. Well, this is Gregory Stanton, 8 Stages of Genocide, and I just wanted to kind of map out our collective history against these 8 standards. So one of the first things we talk about is the pandemic. And then some people are recently talking about the Spanish flu, but there actually was something that was even more dramatic in terms of loss of life, and that was actually colonialism itself. Within the first 100 years, following the arrival of the settlers, 90% of the 60.5 million Indigenous peoples in the Americas died. They call it the Great Dying. And the impact was so severe that they actually can measure it in climate change. And that's what this article is talking about. They can actually see in the earth and in other types of structures, biological structures, how sustaining cultures, when they were eradicated to this extent and replaced from cultures that saw the land as a resource for them, not that they were part of it, how that actually affected climate change going forward. So when we talk about extermination, this is one of the highest levels of what they call depopulation, to put it politely, that ever happened in the world's history that we know about. The second is really looking at Indigenous land in Canada. So 1491, we had 100% of the land. And one of the colonial dialogues we often get is that First Nations are being too greedy. Well, right now, the reserves and the territories account for 0.02% of the land that's known as Canada. So we talk about land claims. I'm not, I think it's important that Canadians understand that the colonial governments are in possession of 99.98% of the land that was once held by Indigenous peoples. And here's the thing about racism. Some of these words, like getting back to Galeano's invisible colonialism, sometimes we use words and we don't even really know where they came from. Now, there's a bit of a historical debate, but many people feel that the first usage of racism was made by this man, General Henry Pratt. Now, as you can see there, Henry was a general in the U.S. Army, and he was actually heading up U.S. military prisons for many years. And they thought, well, you know what? Henry's got the skills to deploy onto another job. So he was actually reappointed to head up what was called the Carlisle Industrial School, which is really one of the first Native American residential schools. And up here in the north, John A. Macdonald, whose statue was just toppled in Montreal, sent down a guy named Nicholas Flood Davin to go see Pratt and his operation. And they Flood Davin returns back and says, you know what, this is a great way of being able to deal with the Indians. And Pratt is the person who coined the phrase that we can kill the Indian in the man. So that is attributed to General Henry Pratt. However, this is where the word racism comes from. So he says segregating any class or race of people apart from the rest of the people kills the progress of the segregated people, i.e. you don't want to keep the savages away from the civilized people because they'll never learn to be civilized. Association of the races and classes is necessary to destroy racism and classism. So it's very interesting that we don't even really talk about where this word comes from, right? So the kill the Indian and the man, that was Pratt. Some people wrongly attribute to Duncan Campbell Scott. In fact, it's in the parliamentary apology, kill the Indian and the child. There is actually no record of that. Duncan Campbell Scott, John A. Macdonald, Laurier, and others would have agreed with that, but that phrase was never said. It was kill the Indian and the man by General Pratt. So this moves us forward to 1895. And the Government of Canada Justice Department, which is another thing about the power of language, the Justice Department was asked to create a warrant for the removal of Indian children. Now, there were two reasons for this in the warrant. One, they could be removed for education, which we all know was not that, or they could be removed for proper care. And the implication of proper care is, one, is they weren't properly cared for in their families. But second of all, that where these kids would be put was proper care. And below that, you see a quote from a police report on St. Anne's Residential School. And you can see here, this is a little girl, now a woman, who told investigators it was a grayish beige color and made from tough material like denim, with zippers down the back and front. The sleeves had fringes to bind the arms together across the front and bindings to secure the hands together behind the neck. What that is a straitjacket, and that child was put in an electric chair at that residential school that clergy and administration would use for amusement, and they would also shock the children for discipline. Now in 2020, Marilyn Bennett's Crown Relations Department is still fighting these survivors and actually accusing them of abuse of process as these survivors try to get these police records so that they can prove to the courts that they are entitled to payments under the residential school system. So these are just kind of clear-cut examples, in my view, that Canada, while it's apologized for residential school, has not learned from residential school. And I'm so glad to hear that Amos is sitting there at Six Nations, because he probably knows very well Mount Pleasant, Ontario, which is where Peter Henderson Bryce was born. He was Ontario's first public health officer and an expert in infectious diseases. And I raised Bryce because he really upsets the apple cart of those who say, well, people back then didn't know any better. Bryce knew better. There was a epidemic of tuberculosis ravaging the residential schools. And he was sent out to survey the health of these kids. And he found out that 24% were dying per year, bringing it up to 69% in one school that had complete records. It was not unusual for Bryce to walk through graveyards on his way to the schools. So he comes back and he tells Canada two things. One is the people in Ottawa were getting 3 times the amount of healthcare funding than all, quote, Indians across the country. He said, equalize out that healthcare and we would see better conditions for the health of these kids. The second is, don't do things like put sick kids in with healthy kids. We're learning all about that with COVID. If you have COVID, you're supposed to self-isolate. Well, they knew that back then. Ventilate the buildings. Again, contemporary health advice that dates back to this time. And make sure that the children are not malnourished and that they're sanitary conditions. All of this would have cost $10,000 to $15,000 for the government to do when they were running a $100 million budget. But Canada said no. And so Dr. Bryce, then a federal public servant, his report gets into the newspapers. And this is the Ottawa Citizen, now the Ottawa Citizen, then the Evening Citizen. It was carried in the front pages of newspapers all across this country. And with these kinds of headlines, like schools aid white plague, startling death rolls revealed. And one of the people that read it was Samuel Hume Blake, who's the founder of Blake's law firm that still exists today. And he said that in the Canada fails to obviate the preventable causes of death, it brings itself into unpleasant nearness with the charge of manslaughter. Now, some people say that Canada ignored Bryce's report. They didn't ignore it. They persecuted him for it, and particularly for this report becoming public. But Dr. Bryce did not silence himself. He kept on speaking out on behalf of these kids until the day he died. But Canada made sure he was erased from the history books. So when I was in high school, I learned about Duncan Campbell Scott, but the word Bryce, I'd never heard of the man. And in fact, it hasn't been until recently that some justice has been done to his memory. But he wasn't the only advocate. This is a child who wrote a letter in 1923. So Dr. Bryce actually released a report called A National Crime in 1922 as part of his advocacy efforts, a real attempt to again stir public emotion in favor of saving these kids. So a year later, Edward B. sends in a letter, and it's addressed to his parents. We don't know if it ever made it to his parents, but you can read for yourself that Edward is so hungry that he and the other boys are eating cats and weed, and that they're being treated cruelly. Now, I told you the letter never really went to his parents, likely, but it did get to somebody important. It made its hands into the man who said no to Bryce, Duncan Campbell Scott. And he was serving as president of the Royal Society. That's right, the same organization that really is the preeminent academic society today. And he was serving as president that year, the same year as Dr. Bryce's report was going around. There's nothing in the Royal Society minutes as academics talking about this controversy. And in fact, Scott received a Lawrence Pierce Medal for his poetic works and 2 honorary doctorates, one from University of Toronto, one from Queen's. And what Scott said in response to Edward B.'s letter is that 99% of the children in the schools were too fat anyway. He received a very big reception by the federal government for his loyalty to the public service when he retired. And he's still on Canada's webpage of Parks Canada as a person of national significance. In fact, you can read the write-up there of him and John A. MacDonald. And on Duncan Campbell Scott, they actually say the reason he's being recognized is as an education advocate. We raised the alarm about this with Parks Canada well over a year ago, but they haven't changed it. So this is 1996, and these are some of the children that Bryce could have saved. In fact, those are children who died of TB at Carcross Residential School, and that was one of the residential schools that Bryce had in his study. I want to draw your attention to this piece, this final line in the middle here with Duncan Campbell Scott. He says here, but this alone, he recognizes the children dying in the schools, but this alone does not justify a change in the policy of this department, which is geared towards the final solution of the Indian problem. That's in 1910. So we know a couple of things from this quote. One is, he knows the kids are dying. He knows that the schools are a problem. But he also knows that he's willing to allow these kids to die in order to perpetuate colonialism. And he uses that phrase, final solution, which of course was deployed to tragic use amongst the Nazi regime in the Holocaust. And what I'm going to suggest to you is that that really hasn't changed that much. I think that this is still happening. So let's go up to the 1940s. And the persistent inequalities are still percolating. And here is a master's of social work dissertation by Mary Twigg Wynne Woodward. And what she's looking at there is the delinquency of girls, for Indian girls in particular. But look at what she says here. The conclusion is drawn that the fate of these Indian girls must promote greater awareness on the part of social work could play in helping other Indian children. The conditions under which the Indians live are a discredit to Canadian welfare standards. So clearly, people in our profession and social worker and child and youth care knew about the problem. People were writing about it in the 40s. And this is the same issue that Bryce had raised. Let's go forward to 1946. This is a submission by the Canadian Association of Social Workers and one by the Canadian Welfare Council. They talk about residential schools, but they never talk about closing them. But they do talk about the dramatic inequalities in services on reserve. And they say that something should be done to address them. One thing about the Canadian Association of Social Workers that's a bit disappointing is they adopted the TRC's calls to action, but they never did the internal reflection about their own role in colonialism, their own support of assimilation. Now let's go fast forward, we click past a couple decades to 1967. This is George Caldwell. He was actually at McGill University in the social work department, and he's hired by Indian Affairs to go out and see what the kids in residential schools are up to. Well, what he finds is, remember that not properly cared for provision? Well, now it's being used often. So when people talk about the 60s scoop, one of the things I really recommend is that you don't just look at the child welfare stuff. You have to realize that residential schools were being used for child welfare placements at that same time. So according to Caldwell, in the 8 residential schools he looked at, primarily in Saskatchewan, 80% of the admissions were due to this not properly cared for thing. And here's his recommendation. The recommendation is that the agency will need to direct more resources and energy into services for children in their own homes, and where alternative care is required, homes in the Indian community should be helped to provide this service. This could be 2020. But as researchers, people are not looking back at these reports. They're not saying, well, the government already knows about the problem and knows how to fix it. They're just choosing not to, and they're using us as a smokescreen to allow that to happen. Here's the Royal Commission on Aboriginal Peoples. By this time, we have First Nations agencies delivering child welfare services, but the federal government is underfunding them significantly and requiring that they use provincial laws. And that's why we have there the note that they have been really boundaried by the ill-fitting rules made outside of their communities. And you see there again, the limited resources and the immediate action that needs to be taken: rehabilitation services, prevention services, continued reform of existing services. So this brings us to now, and here is Canada's worldwide ranking around all kids. And this was just released by the International Child Rights Index, Kids Rights Index, and Canada is rated 54th in the world. And when you get to what really is in the wheelhouse of government, that being the child rights environment that measures budgets and legislation, we're at a stunning 138th in the world. There are about 200 countries in the world, so we're pretty much in the last batch. Like, this is deplorable. especially given the wealth of the country. And as UNICEF has just recently noted, that wealthy countries like ours, the problem for kids, why they're doing so poorly, is because we're not distributing the wealth equally. So we come to 2016, and we have the results of this piece of litigation, which was filed in 2007 to address those inequalities in child welfare and Canada's failure to ensure that First Nations children had access to public services when they needed them, per Jordan's principle. Canada fought this case tooth and nail. And when this decision came out, the Trudeau government was new. The ministers came out, welcomed the decision, and then they didn't implement it. But there's a couple of things that are really important about this decision. One is that the tribunal found key patterns in Canada's behavior. That troubling to the tribunal was how consistent Canada's behavior was in residential schools, the 60 scoop, and now today in the discrimination of the children. That there wasn't a disruption or a clear indication that Canada had learned. The other thing is that Canada looked at Canada's arguments for saying that they aren't discriminating. And they found their responses to be unreasonable, unconvincing, and not supported by the preponderance of evidence. And it's key for you to know that the vast majority of the evidence that we found was actually authored by the government itself. So Canada was consciously choosing to discriminate against children in ways that separated them from their families. We've now had about, I think it's close to a dozen non-compliance orders against the federal government on this case. First Nations families are receiving $3.2 billion more in services thanks to this litigation and all those who struggled in the years to make it happen. But we're not at full equity yet. So that tells you how deep these inequalities are. So this is one of the pieces of evidence. And this was actually written by federal officials. And what they're doing is scenario planning. And they're talking about what would be available to non-Indigenous kids versus a First Nations kid on reserve. And you can see there, if a child needed a wheelchair, a lift, and a stroller, that child off reserve would get those issues, get all of those devices, and any installation costs. But if you're on reserve, you only get one of those pieces of equipment every 5 years. So that just shows you how if you're a First Nations child, you are told you get less or you get nothing because of your race. And a courageous conversation for child and youth care and for social work is, where were we in this? Where was our response to this level of well-known and published discrimination? I don't think that we did very much at all. So here's another example where Canada had adopted Jordan's principle in 2007 through the House of Commons, but then was publicly saying there are no cases. Amazingly, a few cases got through, and one of them was on November 29, 2012. While undergoing dental surgery, a little girl who's 4 years old suffers cardiac arrest and requires assistance in all of aspects of daily living. It's very likely she's in palliative care. And she requires a hospital bed so that she can go home over the Christmas season and perhaps spend the last few days of her life with her family. And her mom is pregnant with another baby. The request goes into Canada. And as you can see here, Canada's response was absolutely not. This request went through at least 15 different public servants before someone said no to this child. Thankfully, a physician in the hospital used his own money to buy the bed for her so that she could spend time with her family. But had it not been for that physician, that little girl would have spent Christmas in the hospital and the last sacred moments of her life separated from her family. And this is 2012. Now, during that same time period, the government, the people who said no, we're working away at ensuring that no was a consistent answer. And Michael Wernick was the deputy minister. Now, some of you will remember Michael Wernick was appointed by Prime Minister Trudeau as the Privy Council clerk. But prior to that, he was actually a deputy minister of Indian Affairs. And he felt these employees were doing such a great job that they should be receiving the highest recognition that the government can provide to employees for their performance. And so he awarded these employees with the Deputy Minister's Recognition Award. So not only was discrimination normalized in the public service, you were rewarded for it. And I want to say too, that in the records of the case, we acknowledge that there were public servants who had the courage to write down and object to Canada's behavior. But in far too often, they were moved out of their positions or they resigned because they couldn't ethically deal with the conduct inside of the department. So if you know of a Jordan's Principle case, thanks to the litigation, you can call these numbers 24 hours a day, 365 days a year. Within the last year, thanks to repeated orders and of course to Jordan River Anderson, the founder of Jordan's Principle, and his family, First Nations kids have received about 250,000 services and products in health, education, and social services that they would not have otherwise received. But the government is not in full compliance yet, but this is an important tool for you to know. So just last year, before the election, the tribunal, in one of its non-compliance orders, links Canada's non-compliance to the deaths of some children and to the unnecessary family separations of thousands of others. And you got to remember, this is on the heels of residential schools, on the heels of the 60s scoop, on the heels of the TRC, and even after the Murdered Missing Indigenous Women report. And this finding is that the panel finds that Canada's conduct was devoid of caution, with little or no regard to the consequences of its behavior towards First Nations children and their families, both in regard to the Child Welfare Program and Jordan's Principle. Canada was aware of the discrimination and some of its serious consequences. Now, the tribunal ordered compensation for the people like that 4-year-old little girl and her family. The government said it wanted to compensate these children, but then judicially reviewed the decision. And that judicial review is still pending in federal court. Now, this is a newspaper clipping I thought I'd throw in. It's from December 26th, I think, or 20th maybe, 1954. And this is from the Calgary Herald. And I was thinking a lot about this particular article during the Wet'suwet'en crisis that we had before COVID hit, where they're trying to defend their territorial lands against a pipeline. And here we have the Stoney Indians, as they would be called in those days, trying to defend their lands against a Trans-Canada highway, which of course we all know was kind of rammed through the whole piece, right? So this editorial is interesting because it's actually saying that the federal government has an obligation to consult with the Stoney Indian band. You can see here, the Indians have every right to expect better land than they have now, and no attempt should be made to foist inferior rocky land on them. They are to be fully compensated if they do not agree, or if they do agree, for any damage which may occur, presumably on the same basis any white citizen would be paid if his land was taken over for the highway purposes. So again, this puts another sharp arrow in this mythology that people of the period didn't know back then, and that there weren't solutions to these injustices. When I look at the long history of the litigation, I came up with some patterns that I saw within the public service. But I think some of these patterns are actually also shared in broader society and indeed within our respective professions. And they're kind of red flags of systemic discrimination. Some of the phrases I hear is it's too complex to get clean drinking water out there. Or First Nations got to be patient. That the government is making first good steps. That you can't change things overnight. Or they will do things like recognize a report but say they're reviewing it, as they did with the MMIWG report, and then never really responded. And they also codify inequality at the community and family level. So they will be happy to provide parenting classes when the real problem is the family has no water. And the real problem is that every other service is underfunded on reserve. They also do dehumanization of children and families using things like acronyms. We had to actually really make positive efforts to make sure the government would say the words Jordan's Principle instead of using an acronym JP, because we want them to speak his name and try to evoke his spirit and memory every time they apply that principle. Or they'll refer to First Nations as a file or an issue. The other is that governments will defend versus praising critiques that come at them. So when someone's saying they're doing something wrong, their immediate reaction is to defend against it. No one inside was spending some time thinking, is this really the right thing to do? Like, what do we need to learn more about what this person or this organization or this First Nation is saying. The other is mistaking process for outcome. This is a huge one. This is where they launch studies, inquests, inquiries. They will have MOU signings with First Nations leadership, photo ops. All of that is used to send a message to the public that the problem is solved. And none of that really makes big change at the level of the children themselves. So it's very important that we measure at outcomes at the level of kids. The other is overstating or diminishing First Nations involvement. So right now, the federal government's fond of saying they're engaging with us. They're engaging with us as partners, or they're having discussions. And that's their way of not being able, of trying to avoid consulting with us, which they're required to do under Supreme Court decisions, as well as the United Nations Declaration on the Rights of Indigenous Peoples. I'd also throw something in here for you to think about, and that is the word Indigenous itself. I'm really concerned that it's becoming a colonial tool. And what do I mean by that? Well, the word Aboriginal and the word Indigenous are both Western derivations. They come from the Western language schools in Latin, and they really mean roughly the same thing from the beginning. But all of a sudden, the government started using Indigenous and renaming itself as Indigenous. And when it did that, I wanted to know why. Because in Section 35 of the Constitution that recognizes Aboriginal rights and title, the word Aboriginal is there, not Indigenous. But then everybody wanted to use Indigenous after a while. And I see them doing pan-Indigenous types of things. And the problem with that is it masks the very sometimes specific forms of structural discrimination that affect First Nations, Métis, or Inuit differently, or within those communities differently. So I think we have to have a courageous conversation about the word Indigenous. I'm not a huge fan of it. Rewarding conformity to bad ideas and punishing moral courage. If you want to be involved in really proclaiming the dignity, the freedom, and the respect, and the rights of First Nations, Métis, and Inuit peoples, then you have to be morally courageous. And what that means is that you have to be prepared to take a hit for standing up in peaceful and respectful ways against discrimination. And the government and other bodies, they will retaliate against you. So you have to practice moral courage. And I really recommend to all of you that you look at a YouTube website called Moral Courage to understand more about how you can do that. Here's Bill C-92. Canada is now saying it's, hey, look, we've done something great on the child welfare file. We're going to allow and affirm First Nations, Métis, and Inuit peoples to take over child welfare. The problem with it is that there's no funding for this, that there's no positive obligations in the Act on Canada to ensure that First Nations, Métis, and Inuit governments have the resources they need. And the other thing is that when we've looked at First Nations philosophical and legal systems, traditional legal systems, no one has a child welfare law. They have children's laws. So it's almost like we're being forced into this colonial headspace, even as they are calling it self-determination. I want to be clear here that I do support self-determination, but I'm just worried about the way that they've constructed it here. Here's one of the promising solutions to all this. This is a report that was just done by the Institute for Fiscal Studies and Democracy in partnership with First Nations leaders. And you can see here, one of the interesting things, even with all of the additional funds that we've been able to secure for child welfare through the tribunal, this report says that the program is still underfunded by $600 million. So again, another sign of how unequal the system is. And that's at the low bar level. If we go to what really I think First Nations kids deserve, we're looking at a need for another $3 billion just in that one program. This is our solution for Canada, Spirit Bear Plan, which is named after him. And it is about why that we need the government to be evaluated under a 360 independent evaluation to find out when it doesn't, why it doesn't do better when it knows better. Because across the matrix of issues, from land claims to resource development to programs like child welfare, Canada is sitting on all kinds of reports. And it has failed to implement them properly. So why is that? What is their way of thinking and doing that stops them from doing that? Or is it by design? Are they actually wanting the results that they're getting by all this inequality? Second question, instead of dealing with these inequalities one program at a time and one drop at a time, we need to cost out all the inequalities: water, housing, sanitation, juvenile justice, child and youth programs, just things for kids to have fun, and then develop something like a Marshall Plan to remedy all of those inequalities. So we would ask for your support on the Spirit Bear Plan. And the other thing we do with Spirit Bear is we do a lot of children's engagement. What we find with non-Indigenous kids is that they get fairness. They understand it developmentally at about age 2. And we are trying to really raise a generation of First Nations, Métis, Inuit, and non-Indigenous kids that respect difference, that know how to stand up against inequality. And so we have children's books and teachers' guides and all kinds of fun stuff like that. These are just some of the court orders. There are so many now that I can't fit them on one slide, but you'll have them so that if you want to go watch or go read some of the decisions later, you can do that. And there's Spirit Bear. And so this is how to get a hold of us. And you can follow us on Twitter to learn more.